Well, we are at the top of the hour, so I'm going to start. So hello, everyone. My name is Lynn Kenny. I'm the Director of Industry Relations with the Center for Health Design. It is really nice to have you all here with us for our Affiliate Connections call this April in the middle of the coronavirus epidemic. And so I always begin my meetings by saying it's just so wonderful to see all of our healthy faces, and even though we're going through a horrible time, we still have a lot to be grateful for, especially if we're healthy. And I hope that's true for both you and all of your loved ones. And so we are trying a different format today as we all sit in our virtual offices. I love seeing all your faces, and I think that the experience will be a lot richer for everybody if we can share our video. And even if you're wearing your baseball cap, it's okay, because we're all working from our virtual office. So I'm going to share my screen. I'll go over a few housekeeping items, and then we'll go over the agenda for today. So just a moment while I get my screen up here. Okay, so you should now be able to see my screen. So I'm just going to repeat something that I was sharing previously. If you use the gallery view, and in the upper right-hand corner across the top of your screen, there should be a little icon there that you can click on so that you can see everyone's faces as well as see the slide deck. So hopefully that's what you're seeing now. And let me see if I can expand this. And it might be more difficult to see everyone as we share the slide deck. I think you kind of run out of room. Okay, so I'm going to encourage you to use the chat box. Again, just sort of play around, hover around on your screen if you're not familiar with Zoom. And we're actually going to try some interactive activities here with everybody today. So if you will have some fun with us and bear with us as we work through the technology. Not only will we be sharing with you some really relevant industry information, but you'll also learn how to use some new tools in Zoom, and hopefully that will be useful to you as well. So I already introduced myself, Lynn Kenny, Director of Industry Relations, and thank you again for being here, and thank you to everybody for the work that you're doing as we move through a really scary time in our world history. Every morning I wake up and I hope that I'm waking up from the bad dream, but it's still here with us. And I do think that we're moving through it as well as we all can. And so we've changed the format of our call this quarter, our Affiliate Connections call, so that we can do a little bit of interactive, networking, as well as share some information from the front lines that Donna Deckard will be sharing with us in just a moment. And we also have Shannon Recklin, our Director of Operations and Strategy, on the line with us, as well as Jill Glazier, and they'll be helping us to monitor the chat box. So please feel free to use that if you have any questions or technical issues, etc. So we'll go through our COVID resources page that the center is updating regularly. Our research team is updating that. Donna Deckard will give perspectives from the health systems, and then we'll do an interactive exercise, a report out, and then we'll close. We are going to offer a similar call again like this on May 6th. And so what we'd love to do is get your feedback if there are specific topics or questions that you'd like us to address in that next call. Just quick reminders, it looks like everybody's already on mute, but that obviously helps to avoid any background noise. My dogs are locked away in their crate, but we're all working from home, so we all have unexpected background noise, right? And then it also helps if you close any unnecessary windows on your computer. That will help with any, connection issues. And if you can, turn on your camera, use the chat box. If your audio is not working well, there is the option in the meeting invite to use your telephone to call in. And then this call is being recorded, I believe. Jill has already started the recording, and we always post the recordings of the Affiliate Connections calls in the members only page on the center's website. So if you find that this call was helpful and some of your colleagues were not able to join the call, they'll be able to listen to the recorded version. And we also have some other really relevant recordings on there. Our last Affiliate Connections call was actually offered by Rutali Joshi. She's a graduate research assistant at Clemson University, and she gave a really nice presentation on surfaces and cleanability based on research she has done. And so I actually have a screenshot here that will help you navigate to that members only page. But before I show you that, I've got a screen up now that just gives you an idea of what you can do during this screen share to be a little bit more manageable, so that you can see people's faces as well as see the slide deck. So you just choose the side-by-side mode under, there's an option across the top of your screen, view options, and you just choose mode. So hopefully that makes the visual aspect of this a little bit better for you. So I mentioned that this call is being recorded and that all of our Affiliate Connections calls are recorded, and so you can go to the members only page. This is like our best kept secret, so I would love to see this posted on our home page, but of course real estate on the home page gets pretty tight. If you go to the About Our Members link on our website, you will see on the in the right-hand column, I've kind of highlighted it with that red arrow, the Affiliate Members Only page. And that's a really great resource because it tells you what all of your member benefits are. It gives you links if you want to update your member profile, if you want to access the Center for Health Design member logo, but it also gives you the links to all of the previous affiliate members' connections recordings. And that's where you can find that recording that Rutali Joshi offered on cleanability and surfaces. So as I mentioned, our research team has been working on a Corona page on our website. You can get to that from just healthdesign.org, and we have a continuously updated list of resources there for healthcare facilities, designers, and for the entire industry. So this is just a quick overview of what you'll find on that page. We created a database called Making Room, which is really designed to help healthcare facilities connect with hotels that have space that they're willing to provide to the hospitals and the caregivers and or patients for surge if they don't have enough space in their hospitals. And to date, we have more than 150 hotels who have entered their information here. So please do share this with any of your industry contacts. It's a great resource, and it's really meant to help all of the folks who are dealing with surge capacity, as well as the caregivers who don't feel safe to return home at the end of the workday. In addition to that, we've opened up the Infection Control Toolbox. And again, this is something you can share with your colleagues and with the industry. The tools in the toolbox are roughly 26 resources, and there are a lot of really impactful items in that toolbox, including an issue brief and resources about how clean hands save lives and the visual cues that we can utilize as part of the built environment design to really emphasize and enhance the, getting everyone to remember the role that clean hands plays. And then also a lot of information about surfaces and cleanability and cleaning processes, as well as access to our telemedicine webinar, because as many of us have experienced during this crisis, telemedicine has sort of made, a huge inroads into our healthcare community out of need. So there's a nice webinar available to you on that as well. On the right-hand side, you're seeing a very small, so I'm actually going to read to you some of the resources, the latest information. Our research is actually adding regularly all of the research that's being done across the industry that can really help inform all of the rapidly, evolving changes that we're making in our industry. So for example, guidance for building a dedicated health facility to contain the spread of the 2019 novel coronavirus outbreak, shelter hospitals, and built environment considerations to reduce transmission. So all of those studies, some of which are hot, like literally right off the press, haven't even been peer reviewed yet, have all been made available to you on the COVID page, so that we can really begin, accessing that learning and put it to use immediately. So now we're just going to do a quick poll so that we can have a little interaction here, and we can all take a look and see all of the various industries that are represented here in our call today. So Jill is going to launch the poll. You should see it on your screen now. If you'd take just a minute to respond to that and let us know what industry you represent. And we'll give folks just a couple more minutes. Looks like we've got about 10 more people that need to respond. And I would say we can close the poll. So we've got a really nice representation from across the industry, and we'll be using polling as well as breakout rooms as we go through. Oh, did you share the results? I'm not sure because I'm seeing the, can everyone see the results of the poll? Good, okay, great. So I'm gonna close out the poll. Okay, so now we're gonna hear from Donna Deckard, and Donna leads our discussions with our Built Environment Network and our Customer Advisory Network, our Grainger Customer Advisory Network. And so that will give you some insights on what we've been hearing in these calls from facility professionals who are on the front lines of the crisis. So I'm going to turn it over to you, Donna. And Donna, you just let me know when you want me to forward your slides.
Okay, will do. Thanks. Hello, everyone. One of the best things that I have the privilege of doing at the center, as Lynn said, is to program and facilitate 2 networks of executive level professionals who are responsible for the design, construction, real estate maintenance for health systems across the country. And when the COVID virus first started appearing in the United States, at the end of February, we started to hold weekly and bi-weekly calls with the members of these networks. And while I know it would have been great to have several of them at this meeting to share with you what's going on, they are really just too consumed right now with the work that they're doing. So it's just me today. But what I plan to do is provide a high-level overview of the journey that these systems have been on from their early response to COVID and then where they are at today. So let me start with just giving you a quick description about the networks and who the members are so you can get a sense of who's participating and where this information is coming from. The first network is our Built Environment Network that was started by the Center for Health Design about 10 years ago. So this group has been together for a very long time, and they've really used the network very effectively to learn from each other, not only in the meetings that we have all year, but really during this time. They've really been very open to share and learn from each other. The network was set up, next slide, Lynn, to have a variety of different health systems. And so we wanted to have large systems such as Kaiser, the Defense Health Agency, the VA, MedExcel or Ascension, and then university systems and other mid-sized systems, and then other premier systems such as Bronson or Metro Health or Boston Medical Center. And then we also have several industry partners who are part of the network: Mazzetti, Steelcase Health, FGI, the Bolt Company, and Whitehall. And so it's a really nice representation of a variety of um, health systems from across the country. Next slide. The Granger CAN system and the network is something that's just started last July. And so it's in the very early stages of forming. And again, it's comprised of different health systems that Granger works with. And also, like Ben, we have a variety of different systems, larger systems like Intermountain, MedExcel, and then a lot of university systems, and then some really unique systems such as the Moffitt Cancer Center. So it's been very interesting to hear from this group and their perspectives. And so as I said earlier, I'm going to try to walk you through the journey that they've been on. It started really at the end of February when we had our Ben meeting in Austin, and the guys started getting calls from people within their health system that they needed to begin thinking about the response to COVID. And what they asked then is, could we set up these phone calls so that they could begin to share what they were learning and if they had questions of each other. And it's been really rewarding to see how they're using the network and how open people have been about sharing and what's been accomplished in just 6 going on 7 weeks since we first started learning about COVID. So let me just kind of take you through what's sort of every 2 weeks kind of what's happened. We had our first call with the Ben members in the middle of March. And at that time, the systems were really just starting to get set up. They were setting up assessment centers, testing centers, and those could be anything from drive-through tents or temporary facilities, but mostly off the campuses. They were really trying to divert people away from coming into the emergency rooms and to their offices. So once they got those done, then they started to create incident or command centers or call centers so that they could begin to start to respond to health systems within their system, because many of these places have hospitals and medical offices across multiple states. So then once they did that, they started to really look at how they needed to change their care delivery in order to begin to create capacity in anticipation of the potential surge that was going to come. And so in that first 2 weeks, they set up these testing centers, assessment centers, and then they began to address capacity and began to think about setting up negative pressure areas, isolation rooms. And in many of the new hospitals, this was a lot easier to do than in some of the older places. For example, Rush Medical Center was able to convert a quarter of their hospital to negative pressure and do that relatively quickly. And they started to really look at shutting down elective surgeries, ambulatory care, other care, in order to create capacity, in order to have the staff and the equipment that they needed to take care of the anticipated demand. Many systems started to see patients via telehealth, and they started to have early concerns about getting PPE or personal protective equipment. They had concerns about the supply chain, and they started to decide whether or not they could continue construction projects or not, and things that had already been started and things that were on the books. So that's kind of what happened in the first couple of weeks in March. Then they really started to prepare for the surge, and most of this work occurred in the last 2 weeks of March and early April. And almost every system converted space to increase the ICU beds, to increase the capacity in all their systems. And they started to wrestle with really tough decisions about where should they house the COVID patients? Should they be in their main hospital or should they be in alternative sites? Many created COVID-only wings in nursing homes if they had those types of facilities within their system. And then they started to convert large spaces, convention centers, auditoriums. They reopened closed wings. they opened shelled spaces, and in many cases, even hospitals that were shuttered or were planned to be demolished were converted into active spaces. They converted PICUs. They moved patients to children's hospitals so that, again, they could create capacity. So one of the things that happened as a resource during this time, because people were creating all of these alternative spaces, was a mini task force that was created by the AIA, and Ellen Taylor, our VP of Research, was a part of that group. And in 5 days, they created a wonderful resource for alternative care sites, and they provided guidelines and a toolkit for people to use as they began to think about standing up these alternative spaces. And if you don't have access to that resource, just let us know, and we can make sure that you have ability to see that, because it's great. Most of the country started to shelter in place. And these incident command centers that I talked about really started to get very functional. They were staffed with experts within the system so that they could get answers out to people very quickly, 4 to 8 hours, about how to set up a negative pressure room, what should they do about construction workers, et cetera, those kinds of things. And construction really did continue in most places unless there was a state mandate to stop. And if it continued, the systems did a really great job about how to handle and continue construction in a safe way, both for the workers and both for the staff and patients at the hospital. So they created separate areas for people to enter. They did temperature and health checks. They had masks and other personal protective equipment, and they did some very responsible things. So, for example, Ascension had a couple of people who were concerned about their health, and they tested them. They tested positive. They shut down the whole job site for several days, decontaminated it, and then started it back up again. But they also started to struggle with supply chain issues and also worker issues, because many people, many of the construction workers said, I don't really want to come to work. I'm afraid I'm just going to go on unemployment and not take the risk of coming to work. And so they started to really face slowdowns in some of the projects, and they also started to see supply chain issues as well, not necessarily for PPE like the health system was facing, but they were facing issues around just getting supplies that were coming from Germany or Asia or that kind of thing. But the other cool thing that started to happen is that people started to work within the community. When they started to have supply issues, the community started to prepare masks and shields and that kind of thing. And places like Steelcase Health did some very quick product development. They were working with one of their local health systems that wanted to have screens developed, and within 7 to 10 days they developed a new product and very quickly got that out to that health system. So things happened very, very quickly, much like what I was just talking about with the resource that was created by the AIA. So now that they've been able to start to address capacity, they began to actually wait to see whether or not the surge actually happened. And a lot of systems were using different modeling systems. There were 3 that they talked about: the linear, the polynomial, or the exponential, sort of low, mid, high projections about what they thought they might need to have in terms of capacity. And so in the beginning of April, they wanted to, we heard a report about what really happened. And it was actually very interesting. In many cases, in many of the health systems, the surge either came early or there weren't really different, they didn't get the surge or the predictions that they thought. And so many places were actually surprised. And on the other hand, there were hotspots, as we all know, across the country: New York, Connecticut, Detroit, Boston, California, Louisiana. And so these places are still waiting to see what happens. But in many of the other places, they're now beginning to think about recovery. And unfortunately, because they had shut down elective surgeries and shut down ambulatory care and those kinds of things, the systems are starting to actually feel a hit in terms of revenue. They've spent a lot of money in, you know, what I just described in terms of getting ready to be prepared for the surge. But with the lack of revenue, they're now starting to look at needing to do furloughs, laying off people, having people work 1 week on, people work 1 week off. In the facilities group, they're starting to have people work in different areas, go and work as spotters or go work in food service or see how they can help other parts of the organization. But they're now starting to begin to think about, you know, what might they do in terms of recovery and what does that look like? And in many places, the other thing they're doing is they're creating spaces for the homeless. Some of the systems are safety net or public health systems. They're not so much worried about PPE now because they're learning how they can disinfect with either UV or hydrogen peroxide or other decontamination systems. So, you know, things are starting to settle down a bit, and, you know, people are now starting to think about recovery. One very sad issue that people talked a lot about is the fact that they are running out of morgue spaces. And so they're needing to find places to house people who have died. So if you can take a look at the systems now, they're running at 40 to 50% capacity. They're trying to figure out, you know, what are the triggers that they should consider as they think about restarting. Many have tried to reach out to patients to get them to come back into the systems, and they're finding a reluctance to do that. People are afraid to come into the health systems for chemotherapy. They're afraid to come back for elective surgeries. They've sent out letters to people, and they're getting a 50 or 60% response. So they're really now trying to figure out how do they begin to create new ways to get revenue and to start the systems back up again. And there are lots of things to consider as you think about recovery. So you've created all these alternative spaces. What do you do with them? Do you maintain them? Do you keep them? How do you start to restore your built environment? You know, the ventilation systems, the building functions, the disinfecting, how to refresh them, how to get reimbursement from the federal government. They've created different cost centers so that they can begin to track the expenses that they paid for. And they're now starting to look at what to do with replenishing their emergency preparedness supplies that they've had. So, you know, we have 2 calls with the health systems tomorrow, actually. And so will be interesting to see where they're at now, given where they were a couple of weeks ago. I think in closing, you know, what I want to talk about is, you know, there's lots of lessons learned, I think, to be captured. One of the things that we've heard from these different systems is that there's lots of new partnerships that have been created, competitors that are working together to stand up existing spaces together. They're sharing staff. They're managing temporary hospitals. They've worked with local communities. So how can some of these kinds of things continue even after we get back to what might be somewhat normal? Construction is going to continue in a very different way. they're needing to maintain social distancing. They're needing to maintain health checks. They now have had to move to staggered shifts, and there's been impacts on productivity and timelines and cash flow. So taking a look at what that looks like going forward. It's been wonderful to see the response of organizations like the AIA, ASHE, ASHRAE, IFMA, the Center, FGI, really trying to create resources very quickly and holding educational webinars for people. So that's been wonderful to see. Addressing the supply chain issues. People have really started to understand the roles that people play in the supply chain and starting to look at what's essential, where's the equipment coming from, who are the decision makers, how do they manage inventory differently, and how do they set up cost centers to keep track of the use of the different supplies. And they're learning how to sterilize and repurpose PPE, and also learning how to share things like ventilators across different health systems. I think I mentioned earlier, telehealth has become a big way in which health systems are caring for people now. Kaiser, for example, it says that 80 to 90% of their visits are now done via telehealth. And so you got to wonder, what does that continue in terms of, how does that continue once we get started again? New solutions have been created, like I talked about with Steelcase Health. The Bolt company created modular inpatient systems working with architectural partners and are shipping those, building those in their warehouse and shipping those out to these facilities that are being stood up. And, places like Mazzetti are working with ASHRAE to create reasonable cold changes. They're trying to capture demand in the surge. Whitehall, their plumbing solutions have been in big demand. So we have to think about, what have we learned and what's the future of work look like in terms of space design, people now working from home, will that continue? What are hotel spaces looking like? What are virtual meetings? How can they be more effective? And then there have been some design issues that have come up in the discussions with the health system. I think one system said, if I just had bigger pipes, I could have really created negative pressure rooms, very much faster than I've been able to do. What do you do about morgues? What do you do? What do you do about resiliency and emergency preparedness going forward? So I'll stop there, but you can see in a very short period of time, kind of the journey that these health systems have been on. The actions that have been taken have been remarkable. The sharing and the willingness to use the network effectively has been really great to see. The guys will type a question out to each other, and within the afternoon, they'll get responses back from 10 different systems with what they're doing. And they ask all kinds of questions like, what does a temporary tent look like? What should the dimensions be? What should the signage look like? What kind of language should we include in all the signage that we're creating now? Should we continue construction or not? So it's been a really wonderful, wonderful way to see people network and learn from each other. So let me stop there. I know that was pretty quick, but just see if anybody
So
has.
Donna, yep, we've got 2 questions that have come in. So I would encourage everyone, if you have any questions, please enter them into the chat box and we'll get through at least a few of them. We are recording the call and we will be able to access the chat box so we can get back to you if we don't get a chance to address your specific question, or you can always email me, lkenny@healthdesign.org. So one question, somebody asked, what were the 3 models?
Linear, polynomial, and exponential, and all had very different numbers in terms of expectations about the surge. Most of the people went with more the mid-range models, but again, trying to figure out how much capacity did they need to anticipate.
And then we have a question, have any of the systems talked about the specifics of what it really means for a terminal cleaning? Have they defined that? You know, when you have a COVID positive patient leave a space, what does that terminal cleaning consist of?
Yeah, we haven't
Has anyone defined that?
Yeah, we haven't gotten to that level of detail. I do think in recovery, now that we're starting to have some of those kinds of discussions, I think they are talking about, you know, when you take a ventilator back, how do you recheck it and you know, get it back into operation? How do you prepare for inspections that are still going to come and they've been delayed now? So how do you begin to think about, you know, how to prepare for those? Thinking about refreshing and sort of, like you said, decontaminating these spaces, and you know, how long do they need to maintain them? And so I think they're really starting to look at, you know, what are those triggers and how do they start to return to somewhat normal conditions.
So the other question that came in is, do we have any sense for the percentage that has been telehealth versus live?
Yeah, I think very high. As I said, Kaiser said 80 to 90% of their visits now are being done via telehealth. That's been true with places like Stanford. Before COVID, I think they said they had maybe 100 telehealth visits. That's now gone up into the thousands. Rush Memorial set up some very quick telehealth spaces, like in conference rooms and things like that. But those aren't probably not ideal. So, you know, one of the big areas I think that we can learn around telehealth is, you know, what's an effective way to deliver care that way? And, you know, in the long term, if we really continue in that manner, then what's the long-term impact on the need for space going forward? Because care delivery may change going forward.
And that clarification question on the terminal cleaning definition. This is Gary Schindel. He's asking, do they strip it to the walls or do they just wipe them down? Has there been any discussion around that, Donna?
We haven't gotten to that level of detail, but you know, we can certainly ask people about that and get back to people.
Okay, thank you. Thanks for the questions, everyone. Why do clients believe their surge projections were so off? Have there been any discussions of the reduction in ED emergent visits non-COVID?
Yeah, I don't, you know, I think many of the systems have been surprised and that their surge, predicted surge hasn't come yet. And I think many are waiting to see, you know, what happens now as the country starts to go back to work, all of that. And so I think the real question now is for those places that didn't get the anticipated demand, I think it's really understanding how long do they keep the capacity that they've created. They had a number that they had to plan for. In terms of ICU bed capacity, isolation rooms, things like that. And so, you know, I think they're all going to be asking that very same question, you know, why were our predictions off? Did the shelter in place and things like that and the mitigation efforts really make a difference? And I think they did. And so we start to think about going back, you know, what will the impact be?
Well, and we did also hear them say, no one has really talked about what a second or third surge might look like. I mean, that is also, unfortunately, right, that's the reality. And when we have each state coming out of their stay-at-home orders, we have really no idea what the impact will be from that. So hopefully it will not result in another surge. So Donna, I just want to say thank you so much. And if folks have other questions, please do email me. And those discussions with the facilities are ongoing. So, you know, if there are specific topics that you're interested in learning more about, please email me or type them into the chat box. Any last questions? Let's see. Oh, one more. Please discuss this will be our last question, and then we'll have to do any follow-up by email. Discuss what these telehealth spaces look like. Is it just video with laptop or FaceTime? Do they have vitals like blood pressure with these, or is it just having someone tell them how they feel and show a thermometer? Yeah, that's actually really, I mean, I can tell you just from my own personal experience, we've done telehealth visits here in our home recently. It's all over the map from my own personal experience, but what are you hearing from facilities?
I think I think there are some very sophisticated systems like Kaiser. Like I said, they had put in all the infrastructure, and they put in, specific rooms dedicated to telehealth, to systems who are just standing up a way to do this very, very quickly. So I think there are lots of lessons to be learned, and really the built environment really does matter when you're doing telehealth and really doing it well. And so I think it's not an easy question to answer, but one that I think we could have an in-service about. In fact, the center's been thinking about actually holding a telehealth workshop in the fall, if we can all still be able to do that, because I think it's such a really important way to begin to think about care delivery and how it can be done differently and how it can be done really well in a quality and safe way.
Yeah, and it's possible that later this year, the Center for Health Design will be offering some additional resources and maybe even a virtual program around telehealth. So please watch your inbox for more information about that. So now we're going to move over. Well, actually, I have one interesting comment to share from Gary. He has a theory about why the ED visits are down. He says all the frequent flyers stopped coming to the ER, and it shows how many ER visits really are not ER or emergent at all, maybe a precursor to the new model. So that is an interesting perspective. Yeah.
Well, it's an interesting perspective. There's actually a really good Washington Post article out about that very topic, and the fact that people, they have seen a reduction in ED visits. And, there's a lot of speculation about whether people are just too afraid to come in for care and have had, minor strokes or maybe minor heart attacks at home, but just haven't actually presented themselves to the ED. And so I think, when you go back and start to look at, what's happened, it'll be interesting to see whether that's really the case, or as Gary said, people really didn't need to come. So, there's probably an answer somewhere in the middle there, but there is a really interesting article out about that.
Thank you for sharing, everyone. So now we get an opportunity to test some new technology. So I want to say thank you to Donna and Shannon, because they are sort of upping the ante with our Zoom capability. So everyone is going to be moved into a smaller room. So you'll be in a room with maybe 3 or 4 people, and you'll have an opportunity to have, quick introductions. You'll be in the room for 10 minutes. Introduce yourself, discuss an important resource that has been helpful to you as you've moved through this crisis, and or share a lesson learned, and also share maybe a topic that you'd like us to delve into in the next call. Then pick a representative from your group who can come back to the main room, and this will all be done automatically for you. And then when that representative in your group comes back to this main room, please enter the highlights from that discussion into the chat box, and we'll ask a few folks to share what they talked about. And just before we move you into those rooms, I want to show you what you'll see on your screen. So on the left-hand side of your screen on the slide, this is what you'll see. Breakout rooms. The host is inviting you to join breakout room 1, 2, whatever your breakout room is, and you just hit join. And then you'll be brought into that smaller session. We'll have a timer going, and then it will count down and tell you when to return to the main room. So you'll be brought into your smaller rooms. Unmute yourselves, introduce yourselves, have a conversation. Again, you want to share a meaningful resource, maybe a challenge or a best practice, and any topics that you'd like us to cover in the May 6th version of this call. All right, so now we'll move into our breakout rooms. Okay, now I hope that was a good experience for everyone, and that's something that we can continue in our next session on May 6th. It's pretty cool. It's a great way for folks to chat with each other and network, especially when we've got a large group like this. So let's see how we're doing on time. We've got about left. Does anybody, how can I do this? Let me look at the chat box. Now we're going to ask that folks enter in, if you are the representative for your group, please enter in because we're going to share this with everybody, the resource that you've found to be most helpful as you've moved through the crisis, and any of the surprising trends that you've seen, as well as specific topics you'd like us to cover, potentially in the next call or down the road. If you'd enter that in the chat, that would be great. So I'm going to have, as everyone does that, Kurt, can I ask you to unmute and just share what you told us in our group about the Construction Owners Association of America and the delays that they're seeing?
Sure. You want to do that right now, Lynn?
Yes, please.
Okay. Yeah, I was on a call yesterday with COA, Construction Owners Association of America, and they polled, there were probably 200 people on the call, mostly owners. They polled them to ask them, how long of a delay do you see in a construction project? And just about half said 1 to 3 months. The next category was 3 to 6 months, and that was about a quarter. And then some of them went out to very small percentage thought they'd go beyond a year of delay to the projects that had already started that have been delayed for some reason. So I thought that was actually encouraging. Now those were the construction people, facilities groups, and they don't actually make the decisions, but that's as close as we get to the decision makers, most of us, and that's their current view right now, as of yesterday.
Thank you, Kurt. And then group 2, I'm going to read what we have in the chat box here. Thanks for sharing that. Group 2 found that programs like Zoom have been incredibly useful during these times on so many different levels. And the group 2 did not see any slow. Oops, I'm losing my chat as new ones get entered. The group did not see any real slowdowns or layoffs so far, and in some cases are actually fast-tracking projects. So that's certainly encouraging. Let's see. From group 1, we discussed trying to manage the post-crisis balance of space needs since we may move to more telehealth, but at the same time need space ready in case of a future surge. And so, Gary, maybe you can share what you've been seeing about surge. So Gary was sharing some interesting perspectives about the fact that, and we heard this from Donna, a lot of hospitals prepared for a surge and then didn't see it. So Gary, would you just quickly share what you were telling us in the group?
Yeah, and again, it goes back to the source of the data is actual ER managers, and they are from Boston to Tampa to San Francisco and points in between. That there's very few ERs are ever close to capacity, and they really are seeing a drop in numbers. Some of them have, or most of them, have converted parts of the ER to dedicated PPE, COVID-19 rule out patients. A lot of them are the worried well that come in and they've got a fever or they've got a cough or they're just ruling them out and waiting for the tests. But the ER is down significantly, and the capacity of the hospital is down. I don't know a single hospital outside of New York that has actually gotten to capacity and has overflowed. So have they retasked rooms like patient rooms to become critical care rooms? Yes, they have. But a lot of it because the elective surgeries are gone, the ER visits are down. So the normal intake of patients is gone. They've really not stressed the capacity of these hospitals anywhere that we've seen.
Thank you, Gary. And then if folks want to take just a moment to enter in any topics or issues that you might want to discuss in the May 6th call, that would be great. And we can, bring in some expert resources to have a discussion around that. And what I also heard in our group, and I'm seeing repeated here in the text box, You know, all of the major organizations that we all deal with every day have been incredibly helpful, whether it's the ASHI, you know, I think it used to be the listserv, and now it's sort of a member network where folks are getting a download of the conversations that occur every day, or resources from organizations like II and Healthcare Design, and of course the Center, the Cost Owners Association of America, and I'm wondering, you know, are there other resources that folks are willing to share, either by emailing me or by texting in the chat box, so that we can get all of that out to all of you as a way to share. Group 6 has seen many projects get put on hold, in any non-essential projects, and they are fast-tracking any COVID-related projects, which certainly makes sense. And labs are next. Large projects that are far enough down the road are continuing with design. We expect a delay and cancel of some other projects based on budget. And I think, you know, Donna might have mentioned this, and I may have been taking notes at the time, but Donna, did you talk about how the Ben group was sharing and the CAN group was sharing, you know, how their revenue streams are down due to getting rid of electives? Yeah. So of course, that's what we're seeing.
But I think as this person said, you know, they're really trying to prioritize projects and what things should continue. Many systems want to go full bore and just keep continuing what they had on the books. Others are prioritizing them based upon necessity and safety. And then there are big projects like the Metro Health, you know, rebuild of their new hospital is just continuing on as planned. So, you know, it varies across systems, but I think construction is going to be very different though going forward. Said.
Everything will be very different going forward. Well, we're at the top of the hour. I want to be respectful of everyone's time, but I do want to say thank you for being with us today. You know, if as I said, there will be a recording available from today's call. We welcome you back for the May 6th call. I see that people have entered into the comments or the chat box topics that they might want to discuss during that time. I want to say thank you for being a member of the Center for Health Design, because we really view this as a partnership. We learn from one another, and I always say we are able to bring you education and resources, but then in the work you all do every day, you bring those resources to life. And so it's a really valuable partnership, and we really are honored to be able to support you in that way. So thank you, and stay healthy, and thank you for being here, and I'll see you all soon. Take care. Have a great day.
Thank you, Lynn. Bye.
Thank you.
Bye-bye.